The doctor is out. At least that's the way it appears to be, as many Albertans scramble to find a physician due to a doctor shortage. And according to a recent report by the Royal Bank of Canada, our country will face a deficit of 44,000 doctors by the year 2028. The report also shows that approximately 6 million Canadians are already lacking access to a family doctor, which is a 30% jump since 2019. To talk more about this issue and some possible solutions, I am joined with Dr. Josh Ramjist. He is a pediatric surgeon at the Hospital for Sick Children in Toronto. Dr. Ramjist, welcome to Bridge City News.
Thank you very much for having me. It's a pleasure to be here.
Likewise. Now, Josh, can you tell us what have you experienced firsthand with these shortages in your neck of the woods?
Yeah, I think here in Toronto, we're experiencing what Canadians really across the country are experiencing. It's difficulty with access. It's hard for families, be it adults or children, to be able to see their primary care physician. And as a result, it's even more difficult to access subspecialty services. And that's primarily because it's like the report showed, we don't have enough doctors.
Now, growing up as a child, my peers wanted to become police officers, firefighters, rock stars, and of course, doctors. And so it seems like there should be many Canadians lining up for their chance to pursue their dreams in healthcare. So where's the bottleneck? Is the issue with our post-secondary education, or has interest in the fields just simply diminished?
No, I don't think interest has diminished. I actually think it's higher than ever. The pandemic has really shown the need, and it's shown a big spotlight on that people want to be in healthcare and they want to be on the quote unquote front line taking care of their fellow citizens. I think our bottleneck is really at the post secondary level. There are plenty of students, plenty of individuals who want to become physicians, but it's so hyper competitive, be it in Alberta or in other provinces, that there's really a bottleneck there of people trying to get into medical school.
Now, here in Alberta, our per capita spending on healthcare is among the highest in Canada. Yet the pressure is put on Albertans to find new physicians as doctors leave the province or retire, and that's felt hard here. What is causing the shortage in Alberta?
Well, I think what it comes down to is a structural imbalance where there are physicians, but they're not in rural areas or they're not in areas where there's the greatest need. And so there needs to be a little bit more equity. And while there are certain programs that are in place that are designed to try to help get more physicians to those areas of need, they simply aren't effective. And so I think what really needs to happen is there needs to be more recruitment of physicians who want to work in either underserved, rural, or just areas that need family physicians.
Now, I know recently our government has been trying to headhunt physicians, even from Ontario, to bring them to Alberta. But generally, doctor, is our healthcare dollars reaching the physicians, or is it getting eaten up in administrative?
Yeah, I don't think a lot of it's coming to the physicians or even to the healthcare overhead. I think there is, unfortunately, a lot of bureaucracy that exists within healthcare, and that certainly requires a little bit of nimbleness in order to be able to navigate that effectively. But at the end of the day, I think what a lot of Canadians and Albertans want to see is that their healthcare spending goes directly towards patient benefit.
Now, you spoke earlier about how you've personally experienced these shortages, but you also have a solution to the problem. You say that internationally trained doctors, such as yourself, can play a role in addressing the crisis. Tell us more about that and why this is a practical solution.
Sure. Again, this is something that I feel firsthand. I'm from Toronto, but I trained internationally abroad in Grenada. And I did my adult general surgery residency in New York City before returning back home to Toronto at the Hospital for Sick Children to complete fellowship. And so I think that an untapped resource are Canadians who study abroad. At my own institution, over 1,600 of our graduates are Canadians who have gone abroad for their education, and upwards of three-quarters of them are currently within primary care.
Now, for some people, they prefer a holistic approach to their health care. Do you think we need to switch to an Eastern medicine philosophy, or maybe a balance of both? And would this help our healthcare situation in Alberta or even across Canada?
I think it's an important adjunct, and I think incorporation of Eastern medicine is going to be necessary. But fundamentally, we are looking for allopathic healthcare, which is the standard globally. And that's what most patients have come to expect and deserve.
And what are the obstacles or objections heard from healthcare systems or governments when the solution is suggested to bring in workers from other countries?
I think what it comes down to is standards of care. And I believe that Albertans and Canadians deserve a high level of care, which they have come used to, which is what they deserve. And so I think it's important that whoever is brought in, wherever they've trained, that they meet what the Canadian standard of care is. And that can be both through testing or through practice experience programs, so that once they are at the bedside and once they're actually taking care of patients, they are delivering the high quality healthcare that Canadians expect to receive.
And I know, like, my family, part of my family comes from India. There's a lot of people in India wanting to pursue a career in healthcare, wanting to become doctors or some type of medical professional. What would you suggest as a career path for someone trained in India that wants to come to Canada?
Yeah, it's a fantastic question. I think the routes to practicing in Canada, it's really about being able to complete residency, which is specialty training in a given area. And so it is competitive to become a resident or to receive ongoing training in Canada. In America, there's plenty of opportunity simply because there are more spots. And so that may be one of those avenues where obtaining residency training in America creates the opportunity to come to Canada afterwards, similar to the pathway that I've taken.
And what are the obstacles or objections heard from healthcare systems or governments when the solution to bring in international workers is suggested?
Well, I think, again, part of the goal is to, like I've said, ensure that there's appropriate standards of care. And then it's also to ensure that the staffing demands meet the population demands. And this is, again, to talk about the structural imbalance. It is not helping anyone if we bring in more physicians and they practice where there are already physicians. We need to see that new physicians are practicing where the need is the greatest.
And it's been said that under Alberta's existing healthcare system, patients are seen as a cost. Now, if Alberta Health Services had a voucher system, could this be better not just for the patient outcomes, but also for the health of Alberta's health system?
Well, I think what's important to remember is that Canadians take a lot of pride in their healthcare system, and we as
Absolutely.
Canadians want to be felt that we are providing the same standard of care to our neighbors as we would want for ourselves. And I think that any system that creates a tiered system or that allows somebody to jump a queue is not going to be well received because fundamentally we believe in equal access for all. And so I think it's important that any new systems still allow the same equity of access.
And are there specific countries that Canada should look to when recruiting more physicians? I know I referred to India, but I was just referring to, like, my family comes from there. But what specific countries should Canada be looking at when if they're looking for more physicians?
Well, I think the obvious one is America. They're just south of the border, and the standards of care that are expected of an American physician are very similar to that of a Canadian. And there are plenty of Canadians who are currently in America. And so creating opportunities for them to be able to return home, to be able to take care of their fellow citizen, I think those will be met well. And that'll certainly help start to meet that demand which RBC has shown.
Now, we talked about someone wanting to pursue a career in healthcare in Canada, coming to Canada, and we talked about a career path where they go to America first, and then they come to Canada. Now, if a physician is already practicing in another country, and he or she decides that they want to move to Canada and start practicing here, what testing or additional learning must be completed so they can be licensed here and have confidence in our healthcare system and working here?
Right. So every province has their own standard pathway for internationally trained graduates to be able to return. And so it can vary from province to province. And I think that that's one of the early areas of opportunity. The opportunity for a national licensure body would ameliorate it being at a provincial level. That way, there's opportunity for a flow of physicians across Canada. I think that the next step is going to be in terms of subspecialty training, given in primary care or in surgery, such as myself, where it's important that the standards of training match that of Canada. And it may be required that that individual has to repeat some of those years in order to be able to pass the Royal College examinations or to be eligible for those exams in their given specialty. So I really think, in terms of a streamlined pathway, one, there is the medical license that the individual would have to obtain, and that's through passing Canadian board examinations. And then two, it will be subspecialty certification, which is going to be based on pre-existing training or the need for additional training.
And how long would all that take?
Well, it varies depending on specialty. Right now, after completing medical school to become a family doctor, there's 2 years of additional training. For most, say, general surgery programs, that can be anywhere from 5 to 7 additional years of training after medical school.
And is there anything else that you want to add? Any final thoughts on this subject, Doctor?
Well, I think that what's important to realize is that this is a problem that we are now seeing really at the forefront, and the pandemic has exposed a lot of our deficiencies in healthcare. I think it's important that new strategies are coming out to where Canadians who want to be able to become physicians have the opportunity, be it abroad or those who are already are trained and want to return to Canada, have pathways and programs in place to help them return to be able to take care of their fellow Canadian.
Now, I know you referred to the pandemic, but this year, like even post-pandemic, there's still a lot of hospitalizations, especially with children, when it comes to influenza and RSV. Do you feel that flus and sicknesses are becoming more advanced, and this is just going to further up the demand for doctors in Canada?
So I do. I think that what the pandemic has shown is that it's shown our communities are susceptible and there's a heightened sense of awareness. And parents fundamentally want to be able to provide care for their children and ensure that they're well cared for. And so I think that we may have a little bit of immune naivety simply because we were in lockdown for 2 years. And so now, as people start to return back to their daily activities, they are more exposed to one another. That's certainly a possibility. But I think we also have a heightened sense of awareness and of the severity of influenza or RSV. And so parents and kids are being much more proactive in seeking out care that they required.
So you're saying that the lockdown actually made our immune systems more frail in that regard.
True, but I also think it made us more savvy. I think that we're a little bit more in tune with it. And that's important. I mean, fundamentally, if you're sick, you need to be able to seek care. And if you're seeking care, you need a physician.
Absolutely, and I know a lot of people were concerned during the lockdown that, well, am I going to get my vitamin D, but I won't be in the sunlight as much, and so there was a lot of concern about that. People were, I remember, like at one time I was going shopping and I couldn't find vitamin D in the store, or like I couldn't find certain vitamins because people were just buying them up along with toilet paper.
Yeah, exactly. Well, health literacy is one of those things that doesn't get taught in school. And unfortunately, it takes these jarring experiences to make us more used to it. And so, again, if we want to try to find silver linings in what was a pretty grave pandemic, the fact that everyone is more health conscious, I think, is good. I think that we're going to see trickle down effects in other areas of preventative care, which is really important.
So, what do you feel needs to change in our educational system to promote more health literacy? Will we need to add something in our K to 12 curriculum?
Well, I think that being able to have that conversation about what does it mean to be sick and how do we start to care for one another, I think that that's important. I think that, when I think about what did I learn in biology, sometimes it can seem a little bit more abstract than thinking about our own personal health. But being conscious of the world that we live in and the way that diseases are spread is an important part of any biology program. And that can start as young as in the K program as well, where we just talk about germs and why do we need to wash hands and why is that important. So it's simple things that can be integrated early on.
Well, that's all the time we have for today, Dr. Ramjist, but we really appreciate having you on the show today.
Thanks. It was a pleasure being here.
Absolutely. Dr. Ramjist is an internationally trained pediatric surgeon at the Hospital for Sick Children in Toronto.